Hi, my name is Jordan Steinhauser, and I'm an occupational therapy student at the Medical University of South Carolina. My classmates and I came across specialized alternatives for family and youth and have a great appreciation for the mission of your organization. We have put together this brief presentation to bring awareness to how OT can possibly be of benefit to your organization and hope that you will find it to be helpful. Occupational therapy maximizes health, well-being, and quality of life for all people, populations, and communities through effective solutions that facilitate participation in everyday living. This is the mission of occupational therapy framed by the American Occupational Therapy Association. AOTA defines occupational therapy as a career that helps people across the lifespan participate in things they want and need to do through the therapeutic use of everyday activities. OT treatments include areas such as orthopedic rehabilitation, sensory integration, self-care skills, mental health promotion, work readiness, and skills needed to return home. Occupational therapists work in a variety of settings, including but not limited to acute care, inpatient and outpatient rehab, geriatric facilities, pediatric facilities, hand clinics, mental health hospitals, and mental health community centers. Through this presentation, we hope to identify how OT can specifically benefit the clientele at specialized alternatives for family and youth. Occupational therapy can benefit children in foster care in a variety of ways. For example, children who experience trauma also experience difficulties in activities of daily living, such as brushing teeth, getting dressed, using the restroom, and eating, as well as leisure, sleep, play, and education. OTs are trained to address these areas in specialized and skilled treatment sessions in which both the child and parent can benefit. Further, children who experience trauma often feel out of control, so OTs work with caregivers to create predictable routines which allow for a more stable environment for the child, thus giving children a predictable routine, allowing them to feel in control and reducing their stress. Occupational therapists may also work with children to teach them healthy coping strategies for dealing with situations in which they feel out of control. Some techniques that are taught include deep breathing, positive visual imagery, progressive muscle relaxation, and meditation to reduce anxiety. Lastly, OTs also promote safe family activities, support self-regulation for children who have difficulty regulating their emotions, and address sleep difficulties and eating issues. It is common that children who have experienced trauma in early childhood may also have difficulty developing healthy attachments to caregivers. OTs work to encourage bonding and help the children create developmentally appropriate childhood occupations. By addressing these areas in treatment sessions with the child and caregivers, there is a possibility to decrease the need for foster care placement, as well as an increased chance of family unit reunification. When children and families are empowered to have access to resources which address their stresses in a positive and constructive way, such as occupational therapy, the family unit can increase their strength and resilience. It is our hope that in the future, occupational therapy can and will become an integral part in the domains of foster care, adoption, and family reunification. Thank you for taking the time to watch our presentation. We will follow up with you within the week to send a survey of how you felt about this presentation. If you have any questions or concerns about the information and topics in this presentation, please don't hesitate to email us. We would be happy to speak with you. If you would like further information, you can visit the American Occupational Therapy Association website, which is aota.org.